Good afternoon, everyone. Good afternoon. Throughout this pandemic, you have heard me reference the incredible work of so many people who have stepped up and offered to help. Today's announcement is a result of one of those moments. A few weeks back, Reverend Jesse Jackson Sr. reached out and connected us with Community Organized Relief Effort, or CORE, which is led by actor Sean Penn. Reverend Jackson has been working with Mr. Penn for years to bring emergency medical supplies to areas around the world that need them most, whether in the lower Ninth Ward in New Orleans, underserved neighborhoods in Houston, or the informal settlements of Port-au-Prince, Haiti. Most recently, CORE has been doing work in Los Angeles and other parts of California in response to this pandemic, and they offered to come here to Chicago. And after a number of discussions with our team from Public Health, we are pleased to announce this partnership here in Chicago. So our thanks for today's announcement goes first to our own Reverend Jesse Jackson Sr., Yusuf Jackson, who is here with us, and to the actor and humanitarian Sean Penn, along with the entire team at CORE. I also want to thank the aldermen who are with us here today: Alderman Cardenas, Alderman Thompson, Alderman Rebollos, Alderman Sawyer, and Alderman Villegas for joining us today. And of course, I want to thank our Commissioner of Public Health, Dr. Allison Arwady. This past Friday, I joined Dr. Arwady to announce our city's first 5-phase reopening framework known as Protecting Chicago, outlining our path to where we are now in phase 2, which has us staying home and physically distancing, through the point when we're finally ready to open all of our businesses and public places and get all of our residents back to work. Now, but as I said last week, reaching that point will only happen when data and science allow for it, which entails meeting a strict set of criteria related to the rate of decrease in the spread of this disease, adequate support systems for our vulnerable populations, assurance that our healthcare system can handle a potential case surge, and finally, having the adequate testing and contact tracing available to track this disease and limit its spread. And it's that last point related to testing that brings us here now. I'm pleased to announce that starting this week, Chicago will be launching 6 new testing sites across our city, enabling us to begin our process of expanding testing from our current level of approximately 3,000 tests per day to 10,000 per day by the end of the month. One of these new sites will be specifically for first responders and healthcare workers, while the other 5 will be located within communities disproportionately impacted by this disease. This new testing network will be operated by the City of Chicago with assistance from CORE, as well as from Curative, an organization specializing in large-scale COVID-19 testing. These sites were selected by the city through a collaborative process between our Emergency Operations Center, our Department of Public Health, and our Racial Equity Rapid Response Team. The city will be directly responsible for providing supports for testing sites, including staffing for site management, safety, security, traffic control, and public health supports. CORE will be working alongside the city to assist in creating the testing sites, identifying additional resources as needed, providing support for staffing and site management, and integration of testing software. In doing so, CORE will draw upon the procedures it's developed working in other cities, and will leverage its existing relationship with our other testing partner, Curative, who will be responsible for providing all testing materials, along with the actual lab testing and data reporting. The populations eligible for testing at these sites will be broken into 2 groups: symptomatic and asymptomatic. Asymptomatic individuals include our first responders and healthcare workers who have been fighting on the front lines of this crisis and have been exposed to a confirmed COVID-19 case. Other eligible asymptomatic individuals include those identified during contact tracing or a cluster investigation. Symptomatic individuals, on the other hand, are what you'd expect. Those experiencing fever, coughing, shortness of breath, chills, and other signs associated with COVID-19. As I mentioned earlier, we are specifically focusing our community-based sites in neighborhoods experiencing disproportionately high levels of cases. And we are thrilled to announce that our first sites will launch later this week. We'll be located at Saucedo Elementary School in Little Village and Dr. Jorge Prieto Math and Science Academy in Belmont Cragen to support our Latinx community. We'll also be opening a site dedicated to first responders and healthcare workers at Guaranteed Rate Field. All other locations will be coming online through the remainder of the month. These include at Kennedy King College in Inglewood, Senka Park in Gage Park, and Gately Park down in Pullman. In a moment, Dr. Arwady will provide specifics on the testing process and how we'll reach a larger percentage of tests per day. But the bottom line is this. These new sites represent a major step in our city's fight against COVID-19. Not only by identifying cases, but also by dramatically improving our knowledge of this virus and its movement across our communities, all of which will halt the spread of this disease, support our efforts to safely reopen our business, and recover from this crisis and get our city back on track. For more information on our new testing sites, please visit our city's website at chicago.gov/coronavirus. And as always, please continue to be safe, act responsibly, and stay home to save lives. Now I'll invite Dr. Arwady to the podium for further details. Doctor?
Thank you, Mayor. So increasing our city's testing capacity is obviously crucial to tracking COVID-19, to limiting our spread, and to ultimately reopening Chicago. Testing rates have significantly increased over the recent weeks, but we still need to do more. You can go to the website at chicago.gov/coronavirus to get a sense of the total tests that we've done, the recent rates, and where we've seen still high percent positivity, meaning which zip codes, which clinics, which areas where we're doing testing in, we're identifying a large percentage of those tests being positive. That is the science on which these testing locations were based. Go to the next slide. Our current positivity rate is at 24.6% across the whole city. We've tested more than 100,000 people to date, and you may remember that the state has set as a goal for reopening a 20% positivity rate in total. We actually are getting a little more detailed than that and aiming at a 30% positivity in our congregate settings, meaning like our long-term care facilities, homeless shelters, and we're actually hoping to get to a 15% positivity in our community settings. So that would be in the clinics and these new testing sites that we're standing up. But overall, we're at about 25% now, and we need to get under 20% by the end of the month. We have also set within Chicago a specific goal of being able to test at least 5% of Chicago residents per month. And that brings us to 4,500 tests per day. You heard the mayor speak to an ultimate goal of 10,000 tests, but that goal of 4,500 a day is where we're hoping to get just over the next few weeks, really ideally by the end of May, beginning of June. And you can see on this same graph, that's actually a graph of how many tests are happening each day. There have been a few days where we've already hit 3,500, but overall we're at about a 3,000 rate of individuals. So we really are hoping to go up 50% just over the next few weeks. There are dozens and dozens and dozens of places that are already providing diagnostic testing in the city. More are being added every day. All of our hospitals, our emergency departments, private clinics, urgent care clinics, and importantly, more than 55 community health centers, including our federally qualified health centers, are now offering testing. I'll remind you that those FQHCs accept people with a sliding scale that goes all the way down to 0 based on income. They accept people who do not have insurance. They accept people regardless of documentation status. And if you are not connected with a primary care provider, we'd like you to get connected. And if you become sick with symptoms of coronavirus, we would like your first call to be to your doctor or to your healthcare provider. That's the best place to get testing. However, we know that still these sites don't have the capacity that we need them to have. Still often we are running out of the deep swabs that are needed to do the nasal tests. We're running out of the viral transport media to be able to transport those swabs. We often still don't have enough of the reagents. We don't have enough of the test kits. And so even where we've been building up to probably close to 100 places around the city, being able to have the capacity to do testing, the numbers are still not where they need to go. Many are being supported through the state, which we are obviously excited about, really looking to partner, and hopefully as more of the promise of federal resources comes through the state, we will see the capacity in these clinical settings build up even further. But in the meantime, in the immediate term, thinking about the next few weeks, really over the next month or two, as we are all so anxious to be able to get to a point where we can start cautiously reopening, we wanted to help fill the gap. And so the other reason that this is exciting is because we are partnering with Core and Curative to use a different kind of test. It is still a diagnostic test, so it's not an antibody. It uses the same PCR technology, it detects the same RNA of the virus, and it has the same kind of emergency use authorization from the FDA. But instead of requiring a healthcare provider to do a very deep swab back in the back of the nose, this testing is actually an oral swab. The patient coughs and then self-administers a swab, wiping it inside the mouth to collect saliva, putting it into a tube, sealing the tube, and then we ship that tube back to the Curative's lab to be able to do the testing. So this is done under the guidance and sort of under the watch of the person who is administering the test. But on the plus side, it requires much less PPE. It requires less healthcare workers. It has the same approval that's in place from the FDA is done in the same level laboratory. It has less risk to healthcare workers and patient exposure. But most importantly, for the challenges we've been having here, it uses a different supply chain than our typical test kits. So we are not just pulling resources from the existing clinics and the existing hospitals that are working so hard to build up that capacity. We're not competing with the same clinical locations. We're not trying to get the same swabs, the same media, the same lab space. This is meant to be additive and likely really a short term over a few months as we're working toward reopening. So adding to our local testing capacity rather than diverting it from existing clinical sites is one of the ways that we're really trying to partner with everybody across the city, across the state, to build up capacity. All along, we've been working to direct testing where it is most needed. We've done that again here. I encourage you to visit the site. We've also worked to identify locations that are near public transportation. We've thought about places that are accessible to vehicles, that have large pre-existing spaces to allow for proper social distancing, but all the guaranteed rate one will be a vehicle specific one. The rest will all also have the ability to do walk-up testing, and we'll be partnering with multiple community-based organizations to ensure people are getting the information and learning about how to access this testing. If people have not signed up for the Chicago COVID Coach, I would encourage you to do that. That is also on the website, chicago.gov/coronavirus. For people who are symptomatic, we will be able to send out information to them, letting them know about some of these new testing locations. And as additional testing comes online, we will continue to communicate that through that app. I think in final, I will remind people that, as always for updates, please go to chicago.gov/coronavirus. You can get the latest on testing every week. We'll be integrating these sites into our regular testing reports and really continue to adjust quickly as needed to meet our goals and help move Chicago ahead. Thank you. I will now bring up Pete DeVries, the consultant from CORE.
Thank you. Good afternoon. Thank you, Mayor. I'm Pete DeVries from CORE. As the mayor mentioned, CORE was started by Sean Penn in order to respond to the Haiti earthquake and has continued to do relief work around the world. More recently, we got involved in the COVID-19 response in Los Angeles in order to help out Mayor Garcetti. They had set up their initial testing sites using the fire department and other first responders, and it was taking away from that critical work effort. So we stepped in and, under their guidance, took over those testing spots and then expanded them significantly. We're currently operating 7 sites in Los Angeles and testing 7,000 people a day. We then expanded into Northern California and most recently into Atlanta, where I just came from. We are working with an implementation model that engages local government, local community, and NGOs. And so far, it has been very effective in rapidly standing up and expanding testing capacity. Often, we're working closely with community and employing people from the communities that are accessing those test sites. Here in Chicago, we're working closely with Mayor Lightfoot and her response team at the EOC, who have been incredibly supportive. And we're also working closely with Rainbow Push Coalition, and they are helping us in our community engagement efforts. We believe that we'll be able to do a very rapid expansion of test sites with these strong partners. In this work, I would like to mention that we're supported by Jack Dorsey's Start Small Foundation. Thank you very much. So now I'd like to bring up George A. Cardenas.
First of all, thank you, Mayor Lightfoot, for this cordial invite. I do want to acknowledge my colleagues. I would like to call them the working caucus, not rhetoric caucus, because they really are here to get things done, provide solutions for communities that need it, and they look for our leadership. Alderman Villegas, our floor leader, Latino, thank you. Alderman Sawyer, I see him to my left, African-American leader as well. Alderman Rivores, the czar of the census, is here with us as well. And Alderman Thompson is a neighbor of mine in the 11th Ward. I share with him parts of McKinley Park. Mayor, a lot's been said about Latinx and Latin communities, that they've not gotten enough testing, that we're left them to fend for themselves. I can only tell you of my experience in working for solutions. That is simply not the case. We've been working nonstop. I've talked to health from the moment that we got off the phone on testing kits from FEMA and the CDC. Mind you, a lot of this comes from third-party sources, so it isn't the cities just magically coming up with their own test kits. We do rely on partners such as the state, the CDC, and also FEMA. So it's got to come from them. It's got to come here, have to assemble it, have to provide the thinking, the where, the how, and all of that requires time, which don't have a lot of it. You see this being implemented. Folks are going to still criticize. Nobody knew about it. Why is this being done so fast? Because it needs to be done fast. It needs to be done right. It needs to be done with a strategy that minimizes risk and gets our folks tested and gets them well and gets them to a point where they feel safe in the city. Thank you for your leadership, Mayor. We're getting there. The health commissioner talked about all the great things that they're throwing at the city. And I feel very confident that we're getting that curve. It's looking downward, which is really what you want. It's no longer upwards, which I'm very confident we're going to get there. I want to also thank CORE and Curative Cora also for their efforts. I know that they spoke. And I just feel so confident in all the stuff we're doing right now to get to that opening of Chicago that is coming soon. But we want people to be healthy, be safe as well. I know 60639, our Latinx community on the north and Belmont Cragen, we're dying to get one. Alderman Sawyer and Alderman Villegas are part of that, and they're also going to get a testing site. So we're not leaving anybody uncovered. Many more are coming, but this is a ramp up significant that we knew was coming, and now it's getting there. Let me say a couple of things in Spanish, because I think people that are viewing and seeing this want to know what's going on in Spanish. Mis concejales, amigos del concilio, hemos creado un nuevo grupo de trabajadores, concejales que trabajan y no nomás hablan. El concejal Villegas, el concejal Reboiras y también concejales Thompson y Sawyer aquí están a un lado, escuchando, viendo nuestro trabajo, implementando las soluciones que están ustedes viendo en estas pantallas del comisionado de salud. Tenemos un nuevo lugar en la Villita María Saucedo, que va a proveer los testings, el testing que ustedes requieren gratis totalmente. Usted tiene que ir, si usted se siente mal, tiene que ir a María Saucedo para que lo puedan recibir y dar el testing necesario. En la área de Belmont Cragen también, Jorge Prieto, la escuela esa en 60639, va a estar libre y abierta sus puertas para poder recibirla, ningún costo tampoco para usted. Queremos que esté seguro, que usted también se cuide a su familia. Por favor, use máscaras. Puede recurrir a nuestras oficinas, concejales. Tenemos máscaras. Yo tengo máscaras en mi oficina. Si usted necesita, proteja a su familia. Estamos haciendo todo lo posible para poder salir de esta situación con todos los métodos y mecanismos y recursos del Estado, de FEMA también. Creemos que lo estamos logrando, la curva está bajando, pero necesitamos su ayuda. Por favor, use la máscara, use protección, y si usted se siente mal, acuda a ayuda inmediatamente y vamos a resolver esto lo más pronto posible. Así es que manténgase seguro, Dios lo bendiga y segura a su familia. Gracias.
Thank you, Alderman.
Thank you, distinguished alderman. Thank you, Mayor Lightfoot, for your steadfast leadership during this unprecedented crisis. On behalf of the Jackson family, my father, Reverend Jackson, the Rainbow Push Coalition, since this crisis began, we have been on the front lines. We've been organizing churches around the country not to congregate but follow the social distancing rules. We've convened organizations of researchers and doctors and medical professionals to develop a medical manifesto that helps explain the crisis in layman's terms. You can find a copy of that manifesto at www.rainbowpush.org. At our national headquarters, 930 East 50th Street in Chicago, in Hyde Park, we've distributed over 7,500 meals a week for the last several weeks to veterans, families, homeless, seniors, breakfasts, lunches, and dinners. And now we are honored to contribute our relationships and our resources to help the city forge a relationship with CORE. We have known CORE a long time. We met them on the front lines fighting disaster in Haiti, and now it's an honor to bring them to Chicago neighborhoods, especially the ones that are disproportionately affected by this horrible, horrible crisis. Mayor Lightfoot, we thank you so much for organizing all of the organs of labor and resources that the city has to bring to bear to fight this terrible crisis. Thank you.
Now happy to take your questions.
Mayor, thank you very much. A member of Governor Pritzker's senior staff tested positive for the virus. About 20 staff members regularly work in person at the Thompson Center. How many people are working here with you at City Hall, and have you or any of your senior staff tested positive for the virus?
No, I have not, nor have any of our team. I don't have a precise number because it varies. What we've been doing is having people working on and off so that they're sometimes teleworking, sometimes physically present. The vast majority of the mayor's office staff for some time now have been teleworking, but I don't have a precise number on a daily basis, but we can certainly get that to you.
Are you testing staff every day?
We are not, but that is something that we are looking towards.
Are you doing it weekly at this point?
We're doing temperature checks, and we're doing, obviously, we're practicing social distancing. Most people are wearing masks as a matter of routine at this point.
The FOP has elected a new president, John Cantasera. What's your relationship with him? How confident are you that you'll strike a contract deal with the FOP?
Well, I know of him, but we don't really have a particular relationship. I reached out to him to congratulate him on his victory, and I hope that we'll be able to find common ground on issues that are important not only to his members, but the department and the city.
A Lim Romanian Pentecostal church in Albany Park defied Governor Pritzker's stay-at-home order. They wore masks, gloves, temperature checks were conducted. Churches are restless. If they gather and maintain social distancing, will you look away, or can churches expect police to take action?
Well, we're not going to ever look away. Look, we put these measures in place, both the governor's stay-at-home order and the things that we've done here locally, because we know that gathering in congregate settings without appropriate protocols and social distancing is exactly the breeding ground for the virus. We've seen that, and we've seen it happen in churches, we've seen it happen in funerals, so we have to remain diligent. I've reached out to the pastor, had a very pleasant conversation with him. We're going to speak at a mutually convenient time. I'm intending to share with him our concerns and what the public health data shows us. My approach always is to try to bring people into compliance through education and dialogue, and I'm hoping that we'll be successful in getting there.
Why wasn't that service shut down? Why weren't people arrested?
Well, look, we're not going to send in the police to arrest parishioners. People are expressing their faith, and I understand that. But it's a mistake to gather in large congregate settings, particularly if you have an underlying medical condition, you are otherwise in a vulnerable population, and that's hopefully the dialogue that we'll be able to have with the pastor.
So is it or is it not your policy to disperse large gatherings like that?
What I've said repeatedly, and I'll repeat it again because I just said it about 30 seconds ago, our plan always has been to try to educate people into compliance. If we can do that, we will do that. We don't want to take more aggressive measures unless we're forced to do that because people are defying it. But we're not going to have a circumstance where people are blatantly ignoring the rules that have been put in place to help save people's lives. So the first I heard about this was late last night. I've reached out to the pastor. I hope that we'll have a constructive dialogue and that we won't have to take other measures to get compliance.
The Chicago Teachers Union wants to bargain over how schools reopen when it comes time for that. They want smaller class sizes. Can you talk about the contingent?
Yeah, that's not going to happen. That's not going to happen. We're not reopening the bargaining agreement. Of course, as always, CPS is in regular dialogue with the CTU. They'll continue to be in regular dialogue with the CTU. We forged an agreement last fall. We're not going to reopen the bargaining agreement. That's not going to happen. We want to do things in a way that keeps the entire school community safe, from the building principal, the teachers, the support staff, and of course, the students. And I think that we can get to a place where we can do that. We'll be in conversation with them, but we're not tearing up the collective bargaining agreement that we just forged last fall. There'll be plenty of time for discussion, but first and foremost, we're going to be guided by what the public health data tells us. And hopefully, we'll have a constructive conversation with the CTU leadership.
Strip clubs pay their taxes like everybody else. Do you think the city's erotic entertainment businesses should be allowed to get a Paycheck Protection Program loan? Admiral Theater says its loan request is in limbo.
Well, I'm assuming what they're talking about is something from the federal government, and we obviously don't set those rules.
All right. Crick Delamore wants to ask about Ahmaud Arbery, that African-American shot to death by two people who say they believe he was a burglar. Do you worry that the requirement that people wear masks could lead to other incidents where people supposedly mistake the intentions of others?
Well, first of all, nobody should be taking the law into their own hands, as those two men did. And I'm hopeful that both the Chicago Police Department here and police departments all across the country are providing training to their members to make sure that it's reflective of the new normal. We're going to be wearing masks in this country for a very long time. And so by virtue of the fact that a black man is wearing a mask, that in and of itself should never be the criteria for assuming that somebody is engaging in specific criteria. But what happened in that Georgia case is these two men decided to take matters into their own hands and hunt this young man down like a dog and kill him in the street. Obviously, the Georgia authorities have arrested them and charged them, and from what I've seen, rightly so. They'll have their day in court. They're obviously entitled to a presumption of innocence, but no one should be taking the law into their own hands.
From Cheryl Corley, are you thinking of any collective action the city can take to recognize people who've died due to COVID-19, a citywide moment of silence, reading the name, something like that?
Yeah, I've been asked that question before, and the answer is we've been thinking about that issue for quite some time, and we'll be rolling out some suggested plans. We want to bring people into the conversation. We've kind of developed a working framework on what that might look like, but we need to make sure that we're bringing parts of the city that have been affected most deeply, both through deaths and cases, into that discussion.
This might be a good one for Dr. Arwane. This is from Lauren Cohn, WLS. There's a lot of confusion over the antibody tests and which ones are most accurate. The FDA recently pulled back on approval of most of them, but she says, I can't find which ones are the most accurate and where they are in Chicago. Quest Diagnostic has one, LabCorp has one, Rush University has one. Are there more, and which is accurate?
Yeah, it's a great question. So there were about 160 companies that were marketing antibody tests, and a number of them had not really done the background work to make sure that you're not having too many false positives and false negatives. And about a week ago, the FDA cracked down and said that any company that was marketing an antibody test had 10 days to provide the data showing that it had done the research that the test, was, quote, accurate enough, and that they would start enforcing against companies that had not done that. Now, the FDA on its website lists these specific tests that have gotten what's called emergency use authorization, or EUA, from the FDA. There were 12 that had gotten that approval last I checked. It could have gone up by a couple. And those are the tests that should be the ones in use. Now, the specific examples that you gave, Quest, LabCorp, Rush, are all using tests that are EUA approved. But I would encourage anyone who is looking to potentially get an antibody test to ask that question and or to look on the FDA website to see which are the ones that have that actual emergency use authorization. Antibody testing is still really early. There's a lot of questions about what a positive test even means. It's not a diagnostic test, so it does not diagnose anybody with COVID. It just lets you know that your immune system has reacted to it. And so it's important that as people start to bring this testing on, that they don't change their behaviors in terms of not wearing their face coverings or thinking that they're fully protected while that science is still pending. The testing that we're aiming for here in Chicago, where you talk about us getting to those 4,500 tests, ideally by the end of the month, that is not antibody testing. That is the diagnostic testing. The first priority is getting that up and going, and then there will be a much larger, bigger work to understand this antibody testing, but it'll be more in sort of weeks to months to come at any significant scale.
Thank you. Dr. Mayer, Adi Quigg asks, we've heard from Rush and DePaul that you're discussing beefing up contact tracing efforts with undergrads. What kind of workforce do we need? What kind of students or folks out of work might qualify? Also, Vanessa at Univision had the same question. What are the city requirements to become a contact tracer?
Well, we've been working on this for some time. Obviously, the bread and butter of public health is contact tracing. They've been doing that from the very beginning of this pandemic, but we recognize that with an eye towards reopening, that we need to substantially beef up the infrastructure for that, and that means bringing more people online. In the first instance, we'll start with our own city workforce, but we're going to need to go beyond that. Dr. Artie and her team are working on a framework. And there's a lot of potential places that we can go to draw contact tracers. We want to make sure that we do that in a way that's equitable, that we're giving some priority to folks that already have established trusted relationships in communities. For example, we have a whole infrastructure that's built up around immigration and refugee. They're called community navigators. That may be one group. We've had some outreach from groups like CARA, who are asking us whether or not returning citizens can be part of the contact tracing group. So we're looking at a variety of different options, and we'll be making some public comments on that soon.
I wonder if Yusef Jackson has a comment for the African American community disproportionately impacted and people who are not staying home, not adhering to the orders. Maybe a comment on behalf of your father.
You know,
We can probably speak for himself.
I wish
That
I
too.
could comment on behalf of my father, but you know, it's a serious issue, and we have to follow the guidelines that are set forth by the CDC. We have to stay home. This disease is taking our friends and our neighbors and our family members, and we're losing lives. So for all communities, African American included, we have to adhere to the guidelines to try to flatten the curve. Thank you.
All right, thank you. Anel, I think I'm good.
I have a follow-up question for Dr. Arwady on antibody testing. Sorry, Mayor. Is the city tracking antibody test results and data?
Oh, that's a question. So any test result for COVID has to be reported by law. And so we are starting to get some of those test results in, so is the state. But the main focus in terms of all of the goals and the guidelines and what we report out here are still the diagnostic tests. I think the antibody tests, we're sort of setting them aside for the moment. There's a lot of questions about what they mean. We want to make sure anything that we talk about here is done in conjunction with our academic partners and also, frankly, with state and national efforts. There are national efforts that are going on to sort of do antibody testing and understand what this looks like at population. So we are getting some of that reported to us, but we're not, we're at this point really putting the primary resources as appropriate into the diagnostic tests because those are the ones that we use to actually control the outbreak.
Thank you. Mayor, question from Amy Jacobson at WIND Radio. The mayor of Seattle has shut down 20 miles of main road to give it to runners, walkers, and cyclists. What phase is the reopening of the lakefront? And at some point in time, you are going to, and I quote, trust the people to do the right thing.
Well, I think we've been trusting the people to do the right thing all along, but also encouraging them and educating them. So there's no bright line there. People are smart, they are savvy, and as we've seen, the reason why we've been able to flatten a curve is because people are also trusting in the science and the data here in Chicago. The lakefront is something that we spend a lot of time talking with. We're talking to those communities that are most affected, and particularly the local aldermen, and they'll be open at a time when we believe that the science and the data dictate that we can reopen, but they're going to be reopened in a way that we can keep enforcing social distance. No matter where we are, until there's a vaccine, until there's an all clear, which is some ways off, social distancing is going to need to continue in all forms of public gatherings. It is the only way that we know to effectively contain the spread of this virus. That's why we keep emphasizing it so much. Every time that I stand up and speak, every time that we're talking about any kind of activity, social distancing has to be something that we have to bake into the DNA of how we operate as a city for the foreseeable future.
Question from Cisco Koto at WBBM Radio. Mayor, are you concerned about the Indiana border and border counties reopening faster than Illinois?
Yes.
Thank you. Question from Shruti at Bloomberg. You have said the city is still studying the numbers, but can you provide a timeline for when the city will provide budget details on lost revenue and costs given COVID-19 and the economic shutdown? What's a realistic time frame to expect those details to update the current budget or next year's budget?
Well, first of all, the costs we've been putting out on a weekly basis when our budget director gives a report to the City Council Budget Committee. Those are posted online every Friday, so those are available. I'm still working through what our numbers are looking like, both for 2020 and for 2021. I've been very clear in saying the impact is going to be significant, but we are still working through to see what the different revenue sources are. There's a lag in some of that reporting, which is why we have not been able to report that out to the public, but as soon as we know, we will let the public know.
Last question from Heather Sharon at WTTW. Why not open a testing site in Auburn Gresham where the positive rate is among the highest in the city?
We are making our decisions about where these testing sites are going based upon the data and the guidance from our public health community, our public health department, I should say. Obviously, Kennedy King College is going to be one of those sites that's nearby. There's a lot of actual testing on the south side. You can see that in the maps that CDPH has been putting up on a weekly basis. But right now we have this very significant surge in the Latinx community. We have to respond to that. And one of the ways that we're responding to that, among others, is to make sure that we've got testing in those communities. And as more opportunities come online, we'll look to expand the testing as far as we can, depending on what the data shows us.
One last question, it just came in. Question from Greg Pratt at the Tribune. Mayor, which church's pastor did you talk to?
The pastor of the church in Albany Park, I believe it's called Elam Romanescu.
Thank you, Mayor. Thank you, everyone.
Thank you, everyone.